The research that's pretty strong is saying 8 hours. Probably, how many people in this room get 8 hours? So that's discouraging, right? Yes. But at 6 hours, and they've tested people extensively, at 6 hours, your thinking levels, your coordination levels, your cognition is significantly impaired, although you're not aware of it at the time. You know, at 4 hours, I didn't get enough sleep. But at 6 hours, you actually do get an impairment that is significant and actually decreases your efficiency. This is an important little piece. So I'm being efficient, I'm working all these hours, but what the research is suggesting is at 6 hours, you're deficient, your function is so compromised subtly, get the word subtly, you're not going around with a headache, sleep deprivation, that you're really losing more time than you're gaining. My clinical observation, which is, I'm going to say perhaps hopeful thinking of this, is that 7 hours seems to be passable. So answering the question as clearly as I can, we want to go for a minimum of 7 hours. And then the other part of it is when are you getting the sleep? The research does show that your optimum time is between 10 p.m. and 2 a.m. for rejuvenation of your immune system, your endocrine system, and your serotonological nervous system. In other words, it builds serotonin. And we know most people, and more women than men, with age, tend to get depleted in serotonin, and we get more depression, anxiety, life dissatisfaction. These are low serotonin symptoms. Oh, so just getting enough sleep, getting your 7 hours sleep is, and during these particular key hours, is really the best way to go about it. Personally, that's the hardest thing for me. I'm slowly getting there. You know, I'm pretty much getting my 7 hours now. But it's a lot of work. It really takes a lot of discipline. So I'm not recommending, I mean, live food, that's easy for me, but 7 hours sleep, wow, that's hard work. So, but that discipline is really important because if you keep in mind that inadequate sleep is going to give you 40 times more depression, it's going to disorder your immune system. There's a much higher rate of diabetes and hypoglycemia and blood sugar disorders with inadequate sleep. Literally speaking, I'm calling that from day to day. That's how literal I am. And if you check your blood sugar and you get 2 or 3 hours of sleep, your blood sugar, your fasting blood sugar in the morning will be higher, 10, 15 points higher. Wow. Literally speaking. That's how intimately it is related to your endocrine function. So when I'm working with diabetics, and people with hypoglycemia, I really emphasize you've got to get adequate sleep at the right time. It really makes a difference. So that's kind of the sleep story. I'm going to tell you 2 more things about sleep, just so we kind of understand the extent. Not only do you have more endocrine stuff, 40 times more depression, but when you go with depression, when people have a severe depression, they're 62 to 82% more likely to get diabetes in the following year. Wow. Isn't that interesting? Those are 2 major researches, one done at Kaiser Permanente, another one done at Johns Hopkins Medical School. Like, wow, isn't that interesting? Now, inadequate sleep is also associated with, as I said, depression, and people who are depressed are 4 times more likely to have a heart attack. That's hardcore information. It's not like a suggestion. I'm talking, this is more of a fact than a maybe. Okay, the literature is out there very explicitly.